Assalamu alaikum. Can you hear my sound?
Yes, sir.
Yes,
Walaikum
sir.
Yes,
salam.
sir. Walaikum salam.
So today's
सलाम सर बिल्कुल आपकी आवाज
and if we just give the revision, we have discussed different steps in complete denture fabrication. So in that case, we discussed that the first step for your complete denture fabrication was clinical evaluation of your patient. So we have discussed these different steps in last class. So we will start from the clinical evaluation of the patient. And we all know that whenever we talk about the diagnosis and the treatment planning, so we have to have history, clinical examination, then certain uh, tools we used to use to have certain things to make them, perfectly diagnosed. For example, radiographs, we have cast, we have old dentures, incomplete dentures, we have photographs as well to make or you to confirm your diagnosis, and ultimately your treatment plan depends on your diagnosis. जितनी अच्छी आपकी diagnosis होगी इतना perfect आपका treatment plan होगा, और treatment plan हमेशा we always used to have different steps to be followed in your treatment plan. ऐसा नहीं है कि आप haphazard treatment करें, उसमें cost भी बढ़ जाएगी आपकी और आपको फायदा भी नहीं होगा. So one by one we will discuss what to cover in your history. Obviously, we have different components in your history. History is just an interview with your patient, and you want to inquire certain things while you are interviewing your patient. Usme bhi you have to make yourself trained to take the history. What are the areas? What are the questions you need to ask from your patient? For example, अगर एक patient आपके पास present होता है with the anomaly, cleft, for example, cleft lip and palate का ले लेते हैं, तो in that case familial history is very very important. But on the contrary, एक 60 साल का बुढ़ा आपके पास आता है और उसके दांत नहीं है, in that case familial history is not that much important and you will not waste your time for your familial history there. तो ऐसे केस में आपको फोकस रहना होता है कि क्या इंफॉर्मेशन आपको चाहिए. You have to make yourself focus on those informations to be, obtained from your patient there. So we have different components of your history तो डिस्कस करते हैं, जिसमें आप जनरल इंफॉर्मेशन लेंगे, प्रेजेंटिंग कंप्लेंट्स को देखेंगे, फिर उसको एक्सप्लोर आउट करेंगे, उससे रिलेटेड क्वेश्चंस करेंगे. देन सोशियो इकोनॉमिकल स्टेटस फ्रॉम योर कंप्लीट ब्रांच पॉइंट ऑफ व्यू इज वेरी वेरी इंपॉर्टेंट. साइकोलॉजिकल स्टेटस को किस तरह से इवेलुएट करेंगे वो भी हम डिस्कस करते हैं. मेडिकल स्टेटस एंड देन पास्ट एक्सपीरियंस एंड एक्सपेक्टेशंस, ये सारी चीजें हम वन बाय वन देखते हैं. सो as you all are the learners and you are the beginners, better to say. So the first meeting is always very very important, not for you people. Till to date I used to have my first appointment with the patient to discuss certain things, to explore out the mental attitude of your patient and the expectations of your patient. Why? Because the success of your treatment is depend on two different things that is very very important. One is what your patient wants, and whether these whatever the expectations are there, whether they are realistic or unrealistic. अगर वो unrealistic है, for example वो ऐसी बात कह रहा है जो कि possible नहीं है, तो you have to teach your patient, you have to educate your patient that this is not possible with this treatment. What we can obtain, we can, 1 2 3 4 5, you can explain that these are the things we can obtain with our treatment. So before beginning, what considerations? Sometimes if you are not able to manage your patients, and you would have this expressions there, my patient is beyond my patience. Why? Because you are not that much trained to obtain certain important information from your patient, and at the end of the day the conclusive things will not be in your hand. So we don't want that. So what we want, that first appointment is always very very important. Why? Because DVM says to meet the mind of your patient is important, or it must be before to meet with the mouth of your patient there. So always try to read the mind of your patient, what type of patient is there, and try to build the confidence in your patient that you are the person who is eligible to deal with the whatever the problems your patient is having there. So for that reason, you have to be a good listener. You have to be a very greedy person, not in a mean यानी greetings आपकी बड़ी